Good afternoon, CMS families. Thank you for joining today's Family Academy Lunch and Learn, Meaningful Medicine, bringing telemedicine, virtual therapy, and career readiness programs direct to our students. Please take a moment to sign in using our bit.ly that is displayed on the screen and has also been added into the Q&A. That is bit.ly/Family Academy sign in. Additionally, today's slides have been included in the Q&A and can be accessed at bit.ly/CMSFA423. If you are in need of translation support on today's call, please select Captions in the top right-hand corner of your screen. From there, select Show Live Captions, and then select the language of your choosing from the drop-down. Once again, please select Captions from the top right-hand corner of your screen, then Show Live Captions, and then select the language of your choosing from the drop-down. And families, we are excited to engage with you today. If you have any questions during today's calls for our fabulous presenters, please feel free to add them to the Q&A section. Simply click Q&A in the top right-hand corner of your screen and a text box will appear. The Q&A will be monitored during the call and all questions will be answered at the end of the call. Additionally, we invite you to share any reactions that you may have today. Giving our presenters a thumbs up, a heart, a wow, or clap emoji for any new learning or exciting opportunities that you are ready to engage with. And if you are interested in reviewing today's call after the session, we invite you to explore cmsk12.org/Family Academy. Here you can find all upcoming lunch and learns, where we'll be on the go with Family Academy, or review the session that was shared today in the on-demand library. Here you can also find all previously recorded sessions. Additionally, we invite you to explore the CMS Family Portal. The Family Portal is the one-stop shop for all of our family-facing resources. If you're interested in learning more about health and wellness resources, we invite you to explore the Community Learning Resources pathway, which is in the top row with the red icon. In this section, you'll also find a health and wellness button that will share more about some of the wonderful offerings of Atrium Health within our CMS system. And at this time, I am excited to turn it over to Ms. Patsy Fisher, the Senior Manager at Levine's Children's Hospital, who will be sharing about the Meaningful Medicine Initiative.
Thank you, Molly, and welcome families. We're excited to be here with you today to share more about our Meaningful Medicine program. I hope we can get lots of emoji reactions and you learn something new or take away something to share with other families. So back in 2022, we were blessed with a generous donation partnering with Bank of America, Atrium Health, Mecklenburg County, and Charlotte-Mecklenburg schools. Part of the Meaningful Medicine program has 6 focus areas: school-based virtual care, otherwise known as telemedicine, school-based virtual therapy, workforce development and career pathways, community virtual primary care, social health screening, and suicide prevention training. I'm happy to announce year to date, we are currently serving 124 CMS locations with school-based virtual care, 32 CMS locations for school-based virtual therapy, and we have workforce development career pathway programs such as Patch, Summer Internship, and Rise to Success that you're going to learn more about today. If you'd like to take an opportunity to learn more on your own, we encourage you to go out to the CMS website, look for the Meaningful Medicine webpage, and take some moments just to read through all the great things that have been shared. So let's dive into school-based virtual care. I'm Patsy Fisher. As Molly mentioned, I lead our school-based virtual care team across our North Carolina and Georgia division. So looking back at where school-based virtual care actually started, in 2017, we launched the service in one Cleveland County school. expanded the program to several other counties in the interim, and in 2022, we expanded the program to Mecklenburg County. Year to date, we are serving 230 schools in 8 North Carolina counties. So looking at a list, Cleveland, Lincoln, Kannapolis, Stanley, Anson, Forsyth, Rutherford, and Mecklenburg are among our counties served. So how does the program work? If a student or staff reports with illness at school, the school nurse or a designee triages the illness and then orders a virtual visit after obtaining parental consent. The telepresenter is dispatched, also known as a medical assistant. They're dispatched to the school. They connect virtually with an Atrium Health provider, and parents and guardians are encouraged to participate in the visit via video or audio if you like. The Atrium Health provider examines the student or staff using virtual technology. They can give a diagnosis and even send in prescriptions to the pharmacy of choice. Most importantly, if the student or staff are not contagious, they can return back to their class or their workday. With permissions, we send notes to the student and staff's primary care doctor. And if a student or staff do not have a primary care doctor, we will help them find a medical home. So looking at some of the services provided, common illnesses, allergies, asthma, cough and colds, ear pain, fever, flu symptoms, head lice, headache, pink eye, rash, sore throat, stomach ache, urinary tract infections. As part of our services, we have the ability for some point of care lab testing, such as strep A and influenza. We also have some send out lab testing for throat culture, COVID, and urinalysis. So here we are looking at our sites on the map. It's just beautiful to see all these locations. Over 120 sites. We've completed over 17,000 visits, and we're looking to continue to grow our program. We'll pause now for a video that can explain the program a little bit more in detail.
A sore throat and an ear pain.
We check their vital signs, ask them what's wrong. One of the goals as a school nurse is to keep all of my students in school and healthy.
As a full-time working mom, it is hard to get off work at the last minute notice.
School-based virtual care has the potential to really affect a student's grades and their attendance. A lot of times that student can be seen that day for that problem and not even miss a day of school. The turnaround time for their illness is usually much quicker.
School-based virtual care is to keep kids really where they need to be. And to do that, we need to be able to offer medical services within the schools themselves. And that's what our program allows.
They offered me the opportunity to take part of the virtual care experience. During the virtual experience, the Levine Children's provider was very comforted and caring for my child. That means a lot to me. I saw everything going on in real time, and I knew my child was in great hands. At the end of the virtual visit, we had a diagnosis and we had a treatment plan.
The parents are able to participate just like they would be if they were in an office here. So even though you're separated by many miles, it feels as though you're sitting in an exam room. Families can be involved and there can be minimal disruptions to both the child's and the parent's life.
As a full-time working parent, this is a great opportunity for our community to be able to utilize this resource moving forward.
The school-based virtual care process is very straightforward. It starts with the kid expressing that they don't feel well, usually telling their teacher, who then refers them to the school nurse. The school nurse then does their own independent assessment to determine if they feel our services are needed. They reach out to consent and ask the parents if it's okay for them to use our services, and to also ask if they'd like to be involved in the visit remotely. After that, a telepresenter is deployed to the school. When the provider is ready, they join the virtual visit, and the telepresenter activates the device that is used. This device allows us to see high-resolution images of the eyes, inside the mouth, also inside the ears, and then to also listen to heart and lung sounds. After the visit is completed with the provider, a care plan is established. And if that involves prescribing antibiotics, they can be sent to the pharmacy. If that involves needing to be dismissed from school because they're considered contagious, the big takeaway is that if they're considered not contagious, they can be safely sent back to the classroom with minimal interruption to the child's life and to the parent's life.
All right, so a question we often have is, what does it cost? So our visits for school-based virtual care, telemedicine, are 100% covered by Medicaid or Medicare. Depending on commercial insurance plans, guarantors would be responsible for copays and deductibles. These are billed as primary care sick visits. No money is collected up front, and you would receive a statement after the services. If we have families that are uninsured, we can automatically qualify families for financial assistance at the time of visit. This includes an attestation to household size and income. And if a family is found to live in 300% or below federal poverty guidelines, they qualify for 100% financial assistance. Other online resources can be found at CMS websites. There's the school-based virtual care link and also clinic locations. So what happens when you're sick at home and you can't make it to school, including parents? We have community access points for virtual primary care listed here for Central Piedmont Community College, Central and Matthews locations, the YMCA of Greater Charlotte, Simmons and McCroy, the Latin American Coalition, and Enlivian Housing. All right, my time has come to an end, so I'm excited to hand it off to our mental health partners, Ashley Wright.
Hello, everyone. I'm so grateful to be here today to talk to you guys about school-based virtual therapy. I'm the manager. I was also the very first full-time virtual therapist when we first launched this program. So the program was actually established back in 1996. Back then, we were in about 20 schools in CMS. In January 2020, that's actually where we kind of started. I was actually in the first 7 schools virtually. Now we are in 300 schools. We are in 21 counties. We are in three states. We are in North Carolina, South Carolina, and Georgia. As of now, we are over 20,000 sessions. Back in 2020, we had 9 therapists. Now we have 35. Actually, it's 38 therapists. So school-based virtual therapy in CMS. So because of the Meaningful Medicine grant, we were actually able to expand. So we are in 32 operational sites in CMS. We have had a total of over 14,000 visits with over 1,000 unique patients. So the objective, provide virtual access to school-based virtual therapy services to students and family. So who? We provide therapy to virtual therapy to 5th through 12th grade students enrolled in either any of our 32 schools virtually. So therapy sessions provided by licensed clinical therapists that are employed by Atrium Health. All of our sessions are conducted either on site at the school or virtually at home. Where a confidential space in schools for students, we use an app called Caregility. The Caregility app is accessible anywhere to parents, guardians using a phone with internet connectivity. They can also use, if they have an iPad or their Chromebook as well, we send a link to those devices and it's confidential. They click it and they have access. When we primarily have therapy Monday through Friday from 8 to 4 throughout the entire calendar year. But if there's times where family want to involved in family sessions, our therapists are flexible and they do have evening sessions as well. Also, one of the benefits of our virtual therapy is that when school is out in the summertime, all of our kiddos have the option to resume services during the summer and breaks, or they can pause sessions until next year. Why? Oh, sorry. Why school-based therapy enables easier access to care. So this is addressing a demand in mental health therapists in our school age population. We are meeting our kiddos where they are. Okay, so how does it work? So before our first appointment, Atrium Health, myself, and the rest of my leadership team, we actually meet with each school individually and we develop an emergency plan. We develop the referral. We kind of go over the referral workflow, and then we kind of coordinate the logistics of how we are going to pull these kiddos. One of the important questions that parents ask is that, hey, we don't want our kids pulled during those core classes. So we do work with the counselors to make sure that they are not missing any of those core classes that are important to them. And we do try to rotate those appointments weekly. How the process works. So need identified. So either the school staff or a parent or guardian recognizes that there is a kid that is struggling and they need therapy. The school staff will then document the consent. They'll reach out to the family members. They'll get the consent and the release of information, and then they will submit it to us. Once we receive that initial referral and the consent, an Atrium Health therapist will reach out to that family member or the guardian, and they will obtain consent for treatment. They will schedule the initial appointment, and then they will confirm the schedule with the identified school staff. So, benefits of school-based virtual therapy. So it is accessible to all students. We are in network with all Medicaid and all major commercial insurance plans. We know that this reduces barriers to care for students and families. Comprehensive mental health support. We support students that are struggling with mild, moderate, or high-risk mental health needs. We have licensed therapists, and we also have school-based psychiatry, which we will talk about in a later slide. Integrated model of care, therapy, and medication management, they're all coordinated in one system. So we work together with our psychiatrists to make sure that the psychiatrists know what's going on with the therapist and the therapists know what's going on with the psychiatrist. So we do work very well together. Convenient and consistent care. Services are delivered during the school day. And like I've talked about previously, is that therapy is year-round, including school breaks. So additional resources, again, you can go to the CMS website, go to the Families tab, Health and Wellness, and then the school-based virtual therapy webpage, and it will actually tell you in detail all of the schools that we are in. So I talked about our school-based psychiatry. We actually have an amazing psychiatrist who works with students. Her name is Dr. Steele. We actually piloted this program in 5 CMS schools in March of 2023. We actually expanded it to 31 schools in CMS in September. Currently, we are active in 51 schools, including the rural areas, who don't have access to a child psychiatrist. We partner with our telemedicine program to make sure that we get the pre-visits. That includes the vitals, making sure that we have the correct pharmacy and things like that before the visit. All right, so now I'm going to hand this off to Lorena so she can talk about the community health workers.
Thank you, Ashley. Good afternoon, everyone. My name is Lorena Perez, and I am a supervisor of community health workers here at Atrium Health. And I am so glad to be here today to talk with you for a few minutes and walk through our social drivers of health, highlight the role of community health workers within the Meaningful Medicine program, and how you can refer to our program. So as Molly mentioned earlier, if you already know about social drivers of health or CHWs, I'd love to see a heart. If you'd love to learn more, let's see some thumbs up. So our social drivers of health and addressing whole person health. Atrium Health is on the leading edge of supporting whole health in our communities by combating important issues that affect the overall health and well-being of our patients and communities. So what exactly do we mean by social drivers of health? So the World Health Organization defines these as non-medical factors that influence health outcomes. These are the conditions in which people are born, grow, work, and live and age. When we think about whole person health, we have to look beyond the clinic. So to make the biggest impact on our patients' lives, we need to fully understand the barriers they may have to achieving health. And this includes understanding if patients are affected by social drivers of health by screening appropriately, adapting care based off identified social needs. And third, and this is where my team comes in, we refer patients who screen positive to community resources through our community resource hub powered by Find Help. And our CHWs play a critical role in bridging clinical care with the real life needs of our patients that our patients face every day, helping us move from treating illness to supporting whole person health. Our team of CHWs work directly alongside families to connect them with resources that they need, things like food, housing, transportation, utilities. These are the basic building blocks of a healthy life. And when families are struggling with any of them, it affects everything, including how their children show up at school. Now, let me walk you through the 5 specific areas where our community health workers focus their efforts. Our CHWs support patients across 5 key domains that are foundational to health. Food, so we connect and help patients and individuals and families access local food banks, food resources, pantries, community meal programs, and also provide workshops and resources on healthy eating, meal planning, and budgeting for groceries. In transportation, we connect individuals to vouchers for public transportation or ride shares. We identify transportation barriers that impact appointment attendance, medication access, follow-up care, while connecting them and educating them on how to navigate those public transit systems and providing resources for transportation planning. Within the housing domain, we guide clients through applications for housing, subsidies, emergency shelters, and affordable housing programs. So we're connecting residents with services for home repairs, maintenance, ensuring safe living conditions, provide information on tenant rights, and assisting with navigating disputes with landlords, and supportive services. Within the utilities, we're assisting and helping clients apply for programs that offer financial assistance for heating, electricity, water, and other essential utilities, and educate clients on how to reduce utility costs through energy efficient practices and home improvements. Safety. So we work with local authorities to promote safety and habitable living conditions within communities, connecting individuals to community-based programs addressing domestic violence, community violence, and bullying. But I must note here that in situations in which safety is the primary need, they require specialized response. So based on or because community health workers are not licensed or clinical providers, safety-only referrals may pose a risk and are best addressed through appropriate and specialized partners. So our CHWs, our involvement are intended to be supportive and secondary when safety concerns intersect with other social needs. Meaningful Medicine CHWs focus on building trust, strengthening relationships, and addressing social drivers that influence health outcomes. It emphasizes listening to patients, understanding their lived experiences, and connecting care to what truly matters in their lives. It recognizes that health is shaped not only by clinical care, but by whether patients have access to getting their basic needs met. And while clinicians address medical needs, this approach requires a team that can support patients beyond the virtual exam room. And that's where our CHWs play a critical role. Our community health workers are trusted frontline team members who have strong connections to the communities we're serving. They focus on relationship building, patient education, care coordination, and addressing the social barriers that often prevent patients from whole person care. CHWs or community health workers are not replacing clinical roles, but instead they complement clinical teams by focusing on what happens between visits and in patients' day-to-day lives. Our community health workers don't just make referrals, they follow up, help problem solve barriers, and this ongoing relationship-based work helps patients feel seen, supported, and empowered. So now that you understand what social drivers of health are and where we focus our efforts, I guess the most important question is how you can help connect families to our program. So let me show you exactly how the referral process works. So when you're referring a family to our program, it's pretty straightforward, and I want to make sure everyone leaves today knowing how to do it. So there are a few ways a referral can happen. It can come from a clinical staff or staff at the school, a staff referral from the school, which comes from a staff member like a social worker, teacher, family advocate. And those are always a trusted conversation between the family and that staff member. You can also do a self-referral, which comes directly from the person in need. And by the way, you don't have to disclose too many details if you're not comfortable in doing so. You're also able to refer yourself during a community event. So a community referral where our CHWs are located, our community health workers are located out in the community, providing information within several community events. So I encourage you to navigate through the resources that are provided within the CMS website, but also you can take a picture of the QR codes on the slide and have them handy. And please don't hesitate to reach out to our team if you have any questions about the referral process. We are here to help, and every referral you make is a step towards helping a family get the support they need. We also have the QR code for the Community Resource Hub in general, where you can explore at your leisure any organizations that may be beneficial to you, to your families, communities, and friends alike. So I will actually now pass it over to Lori with Workforce Development.
Hello, everyone. I'm Lori Chafee. I'm part of Atrium's Workforce Development team. And our youth programs focus on building awareness of the many different careers in healthcare, creating opportunities for students to be exposed to healthcare careers, and providing hands-on learning experiences that give young people the confidence, skills, and the professional networks that they need to navigate their future. PATCH, which stands for Propelling Adolescents Towards Careers in Healthcare, is one of our programs that offer these experiences. The program began in 2015, and since that time has served over 500 CMS students, helping them learn about and prepare for a career in healthcare. Many of our students who have participated in PATCH have returned as summer interns. They've gone on to nursing or medical school, or they are pursuing careers such as radiology, respiratory therapy, pharmacy, surgical technology, careers that they likely would not have known about if they weren't able to participate in this program. So PATCH is a 16-week program that takes place every other Saturday. It's one day every 2 weeks, so that stretches out over 16 weeks. And it's held from 9 a.m. to 3 p.m., runs from January through April at Carolinas Medical Center or CMC Maine. Our PATCH scholars, we call our students our scholars. Our PATCH scholars participate in personal, professional development sessions, and those are led by health professionals, clinicians, participate in interactive workshops, and they get to meet and learn from Atrium employees who work in different fields, of course, doctors and nurses, but also dentists, pharmacists. They work on a really exciting and fun community health research project with guidance from medical students and faculty from Wake Forest University School of Medicine. Wake Forest is one of our partners on this program, and Atrium Health resident physicians. And one of the most exciting sessions, and I've been a part of this, is when the scholars get to present their original scientific research, of course, with the guidance and mentorship of the folks I mentioned earlier. Another component of the program includes academic and career mentorship for college. So students gain experiences that they are able to highlight in interviews and college essays, which is very valuable. Applications for the 2026 cycle, so next school year, will open in early October. We don't have the exact date yet, but the applications will be available on our website, and you'll have the links for those. The program will start in January 2027, and 10th and 11th graders are eligible to apply. And then the next thing I want to talk about is our summer internship program. There we go. So we partner with the City of Charlotte's Mayor's Youth Employment Program, or MYEP for short, on our summer internship program. And these internships provide meaningful work experience, hands-on training, opportunities for career exploration, help students build the confidence, gain the skills and networks that they need to navigate their futures. Our interns have gained experience in fields that were completely new to them. They have maybe never heard of before, such as sterile processing, making sure the instruments used in the operating rooms are sterile. An extremely important job. Nursing administration, social work, the transplant center, anesthesia services, the sleep lab, pharmacy, patient registration, family medicine, and those are just a few of the areas where our interns have been placed. So if you have a student, if you have a child who's interested in being a summer internship, they do need to apply through the MYEP program. And there's also a link for that. That's on the City of Charlotte website. Application, I believe, will be open early next school year. The internship program runs for 6 weeks. Students are paid. Our minimum wage is $18.85 an hour, and they'll work at least 24 hours a week. So keep an eye out for that application when it opens again soon after school starts next year.
Thank you to our fabulous presenters for sharing such valuable information regarding all that is offered to our CMS families through the Meaningful Medicine program. Families, if you have any questions, please drop them in the Q&A at this time. As a reminder, not only does Atrium Health provide mental health services via virtual supports and therapies, we also have our virtual clinics, which all of this information can be found in the CMS Family Portal as you go into the community resources and use that health and wellness button. At this time, I do not believe we have any questions from our community. So thank you so much to the Atrium Health team, and families, if questions arise after today's call, feel free to explore those resources through CMS Family Academy and the CMS Family Portal, and reach out using the Let's Talk OnFlow option on the CMS website, and we will ensure that your questions are answered. You can also contact the program coordinator, Ms. Pooja Palmer, whose email is displayed on the screen. Oh, we do have one question that's come in, and it is, can students apply for the MyApp to intern this summer or put themselves on a wait list?
No, unfortunately, the application period has closed, so they would have to wait until next school year.
Thank you. And if a child currently has face-to-face therapy in their middle school through Atrium, will they automatically carry over to high school, or will they have to re-register within the program? How long does it take to get a provider once they are registered? And when the virtual visit is complete, is there a summary that would be posted in the My Atrium app?
Okay, so the first question is, if they are in the middle school, will they automatically carry over into the high school? If they are in a high school that we service, then yes, they will automatically take over. The clinician will connect with the other clinician that's actually servicing the high school, and they will connect them and make sure that they have all the information. That new therapist will reach out to the family member. If it's a different agency that services that school, we will reach out to the family member and let them know that it is another agency. And we will let the school know that they need to reach out to that other agency to get them connected. How long does it take? I want to make sure. What was the second question? How long does it take to get
To get a provider with the virtual mental health services?
So once the referral is submitted to us, so that means that the school was able to get in contact with the guardian, they were able to get the release of information signed. Once we get it, the therapist will reach out to the family member. We cannot start services until we contact the guardian. So once we contact that guardian, then we can go ahead and arrange for an intake to be completed. We do use the same EMR, so every time that there is a visit that is scheduled, you guys will get an email or a text message saying that a visit has been scheduled. We also write a note in there that you guys should be able to see as well.
Perfect. So when the virtual visit is completed, the summary, it's not posted in the My Atrium app. It's through through what you just mentioned as where that information will be shared with families.
Yes, if they have my chart, then they should be able to go in. Well, you know what? That is not true, because now the kids, once they turn 13, they get their own my chart. So the parents actually will have to get access. The child will have to give access to the parents, saying that they can actually see that chart. And that is across Atrium Health and Novant as well. The parents, once they turn 13, they get their own my chart set up. Unfortunately, we know that's not the best, but that's kind of what the law tells us.
Absolutely.
No, and then it says, will the provider be different for each session? No, they will have one therapist that will carry them out the entire time.
And so that one therapist, are all of our therapists hosted through Atrium, or are they sometimes assigned through other hospitals like Novant?
No, all of our therapists are employees of Atrium Health.
Thank you.
And then it says, will the, I'm sorry, I'm reading it as well. Says, will the therapist connect with a parent or child psychiatrist that is at another hospital like Novant? No, usually if it's at another hospital, then we won't connect. We have to get a release of information to be able to speak to that psychiatrist.
Perfect. Thank you so much for sharing. Our next question does take us to the virtual services. How do you decide which schools get the virtual health services, and will the number of CMS schools that offer these services increase within the coming years?
So we like to serve anyone who wants us to serve their schools. So often the school nurse and principal advocate to our program to implement services at the schools. Over the next few years, yes, I fully expect and hope that we will serve every Charlotte-Mecklenburg school. We're not that far away.
Thank you. And does the family have to have a child at one of those chosen CMS schools to utilize those services? So if they do not have an enrolled student, can community members or families have access to the virtual services at a campus where they don't have an enrolled student?
So services, when students are not part of that facility, we encourage them to take advantage of our community locations that have the similar services to the school-based services. We also have a location at the spa building that can also serve families. And then I think there was a specific question about the resource hub as well.
Yes, if they have to be enrolled in those schools as well for the resource hub.
So I can take that one on. No, so the Community Resource Hub is a free tool powered by Find Help, and it is open to community members and neighbors if you'd like additional or guided support through our team members with the community health workers, you can submit a self-referral to work with one of our teammates to help guide you through not only applications, but walk alongside you with you in your journey to whole person health. So you don't have to have a student enrolled. It's a free tool if you want to navigate that tool yourself. But if you want guided support and health education and all of the other assistance that a CHW can help you with, you can refer yourself to our program, which is the second QR code directly there.
Thank you. And what grade levels are eligible for the Summer MyApp internship? For the Summer MyApp internship, I do believe students must be 16 years of age.
Yes.
So thank
I
you.
apologize. I didn't realize I was on mute. I was talking away. They
Not
do
a-
have to be 16 years old.
Perfect. So if a student is in a previous grade level before that age, are they able to apply or do they need to wait until that key age level?
They need to be 16 by the time the internship starts, which I believe is next year. It'll probably be about the same time, around June 22nd, June 23rd.
Thank you. And then I believe our last question today is, can elementary kids use the care within the services? I believe this would be our virtual cares available.
Yes, elementary students are eligible for the school-based medical care, so the telemedicine. Again, parents are encouraged to join those visits via video and see real time and talk to the provider directly.
Wonderful. Thank you so much. And families, thank you for such comprehensive and engaging questions. A special thank you again to the Atrium team for providing such a comprehensive overview of all of the wonderful services that are provided to our CMS families and community. We hope that everyone has a wonderful Thursday, and we look forward to seeing you at a future Lunch and Learn. Have a great day.